Hi everyone, my name is Dr. Ksenia Gershberg, and I will be talking about breech babies today. What is a breech baby? So a breech baby is any baby that is not in the right position for labor and delivery, which is usually head down. So by 34 weeks, all babies start to settle down in the head down position. If they don't, they are considered to be called the breech baby, and there are different types of breech babies. There are three presentations: frank breech, whereas baby's bottom are aimed at the birth canal and the legs are sticking straight up near its head. There's complete breech, where the bottom is pointing downward and legs are folded at the knees and the feet are near the bottom. There's footling breech. One or both of baby's feet point downward will deliver before the rest of the body. Around 3 to 5% of babies are not head down, and they are called breech. In 2001, American Congress of Obstetricians and Gynecologists, otherwise known as ACOG, advised that if a baby is breech, it is an automatic C-section. In 2006, ACOG retracted their statement and said that it should be up to the physician if the mom should have a vaginal birth or a C-section. But by then, the damage was done, unfortunately, and many doctors were coming out of residencies not knowing how to deliver a breech baby. Baby's position can determine what type of birth a mom can have. If you find out that your baby is breech, usually the ultrasound at 36 weeks will tell you if your baby is head down or not. And if baby is not head down, there are certain things that you can do. It doesn't have to be an automatic C-section. You can try some natural things to do first, and if those don't work, there's always an ECV, which is an external cephalic maneuver, which is done at a hospital. So first, you can see a chiropractor. Chiropractic can help by realigning your pelvis and releasing any tight muscles that can be restricting baby's movement and reduce torsion in the uterus. So what happens is that there's ligament softening hormones like relaxin causes your joints to move more than usual, causing an extra strain on your back and hips. Let me get my model here. This is the spine. And you have 7 cervical vertebrae. These are all vertebrae. This is their spinous processes. And 12 thoracic and 5 lumbar. And then you have your sacrum and your coccyx. And these are your sacroiliac joints, otherwise known as the SI joints. So what happens is you get your joints to move out of place, thanks to relaxin. So most commonly in moms, the sacroiliac joints move. They're out of place. So what happens is if a joint moves, it's in the wrong area, those muscles tighten up because it sends a signal to your brain and says, hey, something's out of place. We need to move that, and we need to move it now. And so what your body does is start to tense up, trying to put that bone back into its place. So that results in tight muscles, and obviously it's not really fixable like that, so you'll need to go see a chiropractor to get that adjustment. So when everything is tight in this area, it decreases space for your baby, and that's not what you want. It also causes a lot of back pain. Also during pregnancy, postural problems, this is big. There's a lot of postural issues because your body is growing as your baby is growing. So everything's becoming bigger. Your chest area is growing, so it's causing a lot of upper back pain and tightness. I find a lot of moms have a lot of muscle knots, a lot of muscle tension in there, especially if their job requires them to sit all day. So, if this is growing, then you have this happening, your shoulders are rounded, moving forward, putting more strain onto those muscles. You also have low back pain, which is very common in moms during pregnancy, and it's caused by your growing uterus, which puts pressure onto your low back. Because of this, nerve compression can occur. You can get sciatic nerve pain. You can also get piriformis syndrome, which is actually very common in pregnancy. Very painful, easily fixable by a chiropractor. Very, very painful and uncomfortable. You can't sit, it hurts to walk, climb upstairs. The piriformis is a muscle located on your bottom. And basically what happens is when that gets tight, it causes a lot of pressure in that area. So very easily solved by seeing a chiropractor. And this all happens because as your belly grows, so it puts a lot of pressure into the arch of your low back, making your back arch and your tummy goes forward. So it creates that curve. There's also the psoas, which are so important and oftentimes missed during pregnancy. They basically start in the first to the fourth lumbar vertebrae. So they start in the back and they wrap around and go all the way down to the front. They insert into the lesser trochanter of the femur. So it wraps around, you have this big muscle that wraps around from your back to your front area. And if that is tight, you can just only imagine what happens. You get lordosis, which is aka overarching of your low back, and this leads to a lot of back pain and very common in moms. So those muscles are very important for your posture and your low back. The technique used by most chiropractors is called Webster's technique, which is a specific sacral adjustment to help facilitate the mother's pelvic alignment and nervous system. So what it does, it focuses on all those muscles and all of those areas, making sure that you are aligned and baby has enough room to move if needed. I am Webster certified and have had success with babies getting actually into the head down position before birth, and it is so amazing, such a great thing. I also have a different technique that I use that most chiropractors don't use. I use a lot of body work that helps moms get ready for labor and birth. So combination of body work and adjustment works like magic. And it's truly amazing when you see the look on that mom's face when baby is head down and the mom doesn't have to go for a C-section, and everything changes. The recovery changes for the mom. She can have the birth that she wants to. There's a lot of factors that change. So that being said, there are certain anatomical and physiological factors that can affect the positioning, such as short umbilical cord, placenta previa. So always ask at your ultrasound where your placenta is located. Uterine fibroids and other uterine abnormalities can cause a baby to be breech, and unfortunately, if you have any of those, it might be very limited if the baby might move. It's also important to ask your healthcare provider how your amniotic fluid levels are. If it's too low, you need to increase it to create more space for the baby to move. If it's too high, there may be too much fluid and the baby just hasn't settled down yet. Baby might just be moving around. So it's very important to know baby's position, and usually a 36-week ultrasound will reveal if baby is head down. You can also know where baby is prior to that by feeling kicks. So if you feel kicks down below, baby is not head down. You want that baby to be head down. So make sure to go see a chiropractor beforehand. And it's just prenatally good to go see a chiropractor. Eliminates all the aches and pains of pregnancy. You want to feel good. You want to make sure you're properly aligned before you go into labor and birth. And chiropractic has been shown to have shorter births. So Chiropractor is just one option. There's also acupuncture can help also. I recommend always chiropractic with acupuncture if baby isn't moving, to do it together. And moxa is great. It's kind of like a cigar looking stick. You can even purchase them on Amazon. Basically you light it up, put it next to your big toe, and just wait, and it usually helps also with turning the baby. Other things can help are spinning babies. So Spinning Babies website has a lot of inversion exercises. Inversions help a lot. And my favorite is also birth ball. So, if you're sitting throughout the day, your job requires you to sit all day, this is not going to create a great position for the baby. So I always suggest interchange it with the birth ball. Don't sit on a birth ball all day. And one of those birth balls is like a yoga ball. So basically you could just sit on a ball, half an hour, then walk around the office, then sit down again on a chair, and always interchange it. Make sure that you're moving throughout. Make sure that you're getting good walks in, some good exercise in if you can, and help that baby churn. Thank you so much for listening today. Have a great day. Bye.